Welcome to Hand That Rocks the Cradle, where we explore the journey of motherhood. And today we are focusing on a topic that touches the lives of many women, which is postpartum recovery. Joining us in this insightful discussion is Dr. Balakumari, a very highly respected gynecologist and obstetrician based in Chennai. With an impressive 33 years of experience in the field, Dr. Bala brings a wealth of knowledge and expertise. Not only is she a distinguished member of the Tamil Nadu Medical Association Council, but also a passionate advocate for women's health. Welcome to the podcast, Dr. Bala.
Thank you, Hina. I'm very happy to join. And hello, all listeners.
Awesome. Doctor, so we have a very vibrant community of mothers, and as you can expect, there's a lot of lack of awareness in this journey that women go through, which is pregnancy and postpartum. And we hear a lot of questions. I was hoping to ask you some of those questions in today's session and get your expert opinion on the same.
Sure, I'll happy to answer all your questions.
Awesome. So the first thing that I would like to understand is clearly pregnancy, it's very visible, the kind of changes that women's body go through. But what exactly happens and what are the significant physical changes that women go through just after childbirth?
After childbirth, see, the changes are all through the body, right from your brain to your skin, everything changes. During the 10 months, the pregnancy hormones produce lot of effects, and once the hormones go away, and with the new addition in the family, it's a new responsibility, and you have to take care of your health and your baby's health. The workload is more, and depending upon the support from the husband and the family and how fit you are, the changes will happen. Generally, see, immediately after birth, there is a lot of fear for the women. Okay, will I be able to do the best for my baby? Everyone wants to give the best to their baby. But thing is, as a mother, nature has endowed you with the capacity to tackle the new situation. The baby and yourself, you will be able to take care. So first you have to tell yourself, yes, millions and millions of women have done this. I will also be able to do that. That confidence gives you the energy to do all the things that are needed. Okay. So the taking care of your health, okay, is very, very primary important. Only if you're healthy, you can take care of your baby. So taking care of yourself, physical and mental health. This is the time. Physical health always, remember, involves two things. That's diet and exercise. Appropriate diet and exercise. And adequate rest. See, for the next 1 year after your delivery, you will not be able to have a schedule. You can't eat at the correct time. You can't sleep peacefully for 6 hours. So mentally prepare yourself. This is going to be like that. So I will take short breaks whenever needed. So whenever the baby is sleeping, you also lie down. Even if you don't feel sleepy, you lie down, give rest to your body and mind. Okay. And one thing is short breaks. Eating, even if there is no continuous work, you have to eat in time at the correct quantity. I think we should have a discussion about diet separately. Absolutely. So basically understand diet, exercise and adequate sleep. Okay. So these are the three vital things that a mother should concentrate post-delivery. If she takes care of herself, she will be in a good position to take care of her baby.
Absolutely, doctor. For sure. And very well said, especially, the mother's immediate focus becomes the baby, right? From the moment you give birth. I have two daughters. I know, like, the second they were born, it was all about them. And for the child also, doctor, we have a very well established system, because the moment they're born, but day wise we have checkups for the child, and vaccinations and everything is written nicely in a booklet for the child. However, for the mother, I believe there is only one single checkup. Is there anything else that women need to go and get checked for themselves in terms of postpartum checkups? Basically, what are the postpartum checkups they can go for, and why is it important for women to do it?
Generally, the women are discharged on the second or third day after her delivery. She has to go for a review 1 week to 2 weeks after delivery. Okay, so that is a must to know whether her uterus is involuting normally, if there is a wound, an episiotomy wound or a cesarean wound, whether it is healing properly, whether her BP is normal. So this checkup is a must. Then, preferably 1.5 months later, that is 6 weeks after her delivery, there need to be a follow-up. Even women with cesarean can start exercises, body exercises, abdominal exercises, and the pelvic floor exercises. Okay, can be started at 6 weeks. Okay, many of us don't focus on exercise. It is as vital as diet and rest to restore your body and mind to normalcy. So, at 6 weeks, when you go, you should have a checkup of your hemoglobin. And if you had diabetes or thyroid problem during your pregnancy, you need to check your thyroid value and sugar value. Okay, hemoglobin, sugar, thyroid. These three things must be checked. And another important aspect is there is a vaccination called HPV vaccine. This is a vaccine used to prevent cervical cancer. That is, cervix is the mouth of the uterus. Okay, so to prevent that cancer, we vaccinate the women. This vaccination can be done anytime after 9 years of age. But most of our women, actually Indian population, only 1 to 2% of the women are vaccinated. Why do we advise post-delivery? Because post-delivery for the next 6 months, you will be going to the doctor, to the pediatrician. So if you also have your vaccination schedule at this time, it's easier to remember and follow up. You may not go separately for this vaccination at other times. So there are 3 doses in this HPV vaccination. Okay, you can have, if you have today, that is 0, then 2 months later and 6 months later. So that 6 weeks checkup will be to have your full body BP, weight, everything checked, have a dietary advice, start doing exercises, especially abdomen and pelvic floor exercises. These pelvic floor exercises are very, very important. During pregnancy, the support around the uterus weakens. Okay. Women who have delivered normally, about 30% of them have what is called as stress incontinence. That is, leaking of urine when you laugh or sneeze or cough. That is a very, very embarrassing thing. You go for a movie, if there is a comedy scene, you laugh and then you get your dress wet. How embarrassing it will be. So, this can be prevented if you start pelvic floor exercises much early. Women who have delivered normally can start right from day 7, that is 1 week after her delivery. For cesarean, women who have undergone cesarean, they can start pelvic floor exercises 7 days after delivery. But abdomen exercises, they should start only after 6 weeks. So this 6 weeks checkup will be full body checkup, hemoglobin, sugar, thyroid, and ask your doctor about HPV vaccination.
That was so amazing, doctor. I think there is such a lack of awareness, especially around the HPV vaccination. I know for a fact I'm due to get the vaccination, but I think after this discussion, that's the first thing I'll do the next day. But thank you so much, doctor. It was very, very important because I had a normal delivery, but I know women who've had C-section, and I didn't know the difference between the pelvic floor exercises versus abdominal exercises and the timing. You explained that so well. So thanks a lot for that, doctor. We spoke about the timeline, right? The 6-week mark, which is a mark, mental mark for most women, that's around the time when they recover. Honestly speaking, a lot happens in the woman's body. How long does it truly take for a woman to actually recover from the postpartum experience?
3 months minimum for the body to recover completely to pre-pregnancy state. It takes about 3 months physically.
You mentioned that there are certain factors that women can keep in mind for expediting this timeline, right? And for even after 3 months, honestly speaking, in the community, half the moms are like, I still have the mom belly, or I'm still struggling with stamina, etc., etc. You said that diet, nutrition, etc. can help to bring down this to the 3 months, or how much of an impact does that have basically on the women who are post 3 months, post the 4th trimester?
Coming to diet, see, when you breastfeed the child, you need a little extra nutrition. Okay, that will be around 300 to 600 calories. People think that they have to eat so much, they overeat, put on so much weight. We talk about not losing weight postpartum. Postpartum is post delivery. Okay, post delivery, and retaining of the weight that was gained during pregnancy. They have found out in researches that if the woman do not lose the weight that she gained during her pregnancy, during this first 1 year of delivery, she tends to remain obese lifelong. So it is very, very vital to shed the weight, extra weight that you gain during pregnancy, during this post-delivery period. And as I said, many people, no, I'm breastfeeding, I cannot do any dieting. When you breastfeed, I told you 300 to 600 calories. Let's just take an example. One egg will contain around 80 calories. One banana will have about 80 to 100 depending upon the size. One spoon of ghee will have around 20 to 50 calories. Okay. And see, this itself comes to around 200 calories. Right. One extra glass of milk. That's all you might need. Okay. An extra glass of milk, maybe an extra egg per day, or a spoon of ghee, or a banana. This can be compensated by other means. When I say banana, it can be compensated by other fruits. When I say egg for vegetarians, it can be a little extra dal or sundal. Okay, so like that, you need only this much of extra calories. So people tend to overeat. That should not be done. People who are already overweight, these people should compensate the extra calories. Actually, they don't have to take even up to 600 calories. It's enough if they take around 300 calories. And that should be by way of vegetables and dals, not by taking extra rice and its cereals like rice, chapati, dosa, idli, all this, ragi, all these are all base carbohydrate containing food. For people who are on the overweight side, don't increase these carbohydrate containing food. Increase the protein content. For vegetarians, it will be dals and pulses. And for non-vegetarians, it will be chicken, egg, fish, etc. So increase the protein quantity, increase the amount of fibers, that is vegetables. And fruits 3 times a day is a must. Okay, to pass motion freely and to get the extra vitamins that you need. The diet pattern.
Very helpful, doctor, especially the bit where you said that there's a difference in trying to get calories from vegetables and dal as opposed to just eating more rice or maybe having dosa. There's a huge difference there which a lot of people don't know about. Another thing which you said, which really hit me personally, was, if you shed the weight in a year, then it goes, but something which is after a year is more stubborn to lose and probably requires a bigger lifestyle intervention for you to change. And doctor, women who have either normal delivery or C-section, honestly, in both cases, most of them even in normal delivery, you get stitches. In C-section, you have that C-section scar. What are certain precautions that these women should be taking just after delivery?
These women, see, the basically wound healing, it should be free of infection and the woman should have adequate nutrition. Okay. Free of infection is keeping the clean wound. People who are again overweight, the wound healing takes a longer time and the chances of infection are more. So obesity affects in all ways. So pre-pregnant itself, you try to attain the normal weight and try to become pregnant. During pregnancy, gain weight that is only recommended for you. Not every woman should increase by 10 to 15 kgs. Okay. Women who are already overweight, if they increase even 5 to 7 kgs, that is sufficient. So keeping your weight under control, keeping the wound clean, and keeping the wound clean and dry. Even the cesarean wound, remember, you have to keep it clean. Many people think that they should not have bath or water should not be poured over the wound. It can be after the third day. Okay, after 3 days, they can easily wash the wound with soap and water, and it is better they wash. Because see, cesarean scar is generally in the lower abdomen. There is a fold of fat, right? If sweat accumulates in that fold, and if you don't clean it, then only the wound gets infected. So in fact, if the woman is a little on the overweight side, she can lift up the tummy, lower tummy, pour water over the scar or the wound, a little soap, and wipe it dry. That is very, very important. And this fold and all, if there is too much, that should be corrected with the belts and dresses that we are now, finding more often in the market. Previously, it was only tying with a tight cloth, but now we have dresses which can help in not folding up this abdomen.
Yes, absolutely. I think, doctor, you reached my next question, which is, a lot of women, because the belly that happens right after postpartum, right after you've had the baby, the old way of doing it is tying it up with a sari, and then otherwise you have postpartum belts, and they're extremely uncomfortable, especially if you're a working mother or stepping out, or even if you're at home. And one of the things we did internally was we did a lot of research. We built a supportive clothing around this. But overall, the importance of managing your belly area, because we briefly spoke about it, doctor, I would want you to share that insight with the larger audience as well. The belly area, and protecting it, managing it, holding it together in the days and the weeks that are postpartum is very important, no matter how you do it. In olden days, whether it was sari, now we have postpartum recovery leggings. If you can just shed some light, doctor, on why that piece is important for the 3 months and the period after delivery.
Post delivery, the abdomen shape, there can be 3 problems. Okay, one is the lower abdomen fat bulging out. Okay, the second thing is what is called as divarication of recti. You have seen these 6-pack muscles, no? All the strong men have 6 packs. We also have that muscle. That muscle separates a little for women, especially when they are on the thinner side and if their muscles are not very strong. That is called divarication of the recti. Recti is the muscle. Rectus is the muscle. When it is plural, we call it recti. Divarication is both of them separate. So in the middle, you get a bulge through which the bowels protrude. And the third thing can be what is called as umbilical hernia. Okay. So all these 3 needs an abdomen support. If there is a support in the clothing, which lifts up the lower abdomen belly, gives a little pressure on the sides so that the rectus muscles which separated unites in the middle. And of course, there is a center umbilical hernia which can be supported by a strong support in the middle. This can be in the form of abdominal belts. It can be in the form of post-delivery innerwear, where it is elastic enough to expand to the size and tight enough to put these muscles into union. Okay, so the abdomen, you get a shape that gives a support and a good feeling. And in addition to that, when you do exercises, the muscles become stronger. You get a good shape within a year. But within that 1 year, if the woman is like, very thin, weak, she needs these extra support. Women who are obese also will need this because they also have these problems.
That was very helpful. When they look in the mirror, one of the first things is, oh my God, I'm looking so different. Right. In terms of postpartum, everything that happens to a woman physically, it's also coming to the topic of menstrual cycle. So a lot of women report very, very varied expectation of the menstrual cycle. So what actually is normal and what is abnormal? What should women expect post childbirth? What kind of menstruation happens, in what duration, and when should they actually visit a doctor and say that, okay, this is not normal?
When the woman is breastfeeding, there is a hormone called prolactin, which secretes in large quantities. Okay, as long as this hormone is in the body, the woman may not menstruate at all. Okay, it may be up to 1 year if the woman is fully breastfeeding the child, doesn't give any extra feeds to the child, then she may not menstruate even for a year. But if the woman is not breastfeeding, she may start menstruating even within 2-3 months. The initial cycles may not be very regular, like not a perfect 28-day cycle. It may be random. So, depending upon the breastfeeding, the cycles may resume early or late. But all should remember one thing. If the woman is not even menstruating also, sometimes she starts ovulating. Or the first ovulation may happen when she is not menstruating, and that might get pregnant. So 3 months after the delivery, it is better to follow, it is good to follow any mode of contraception. It can be condoms for the male, it can be copper T or Mirena for the lady, it can be, there are pills which can be taken during breastfeeding, but the regular contraceptive pills which contain estrogen and progesterone, generally we don't advise during breastfeeding. Okay, so this contraception is very, very important. Many women, it's 6 months babies, 9 months baby, 1 year baby, they come with pregnancy for an abortion, which is not a good thing. So prevention is better. The reason they say is, I never thought I will become pregnant so soon. I mean, like just by thinking, like I don't want to become pregnant, it doesn't happen, right? So you have to take a precaution. Right. That is, and I find even educated women do that mistake. So when should you report during post-delivery, the menstruation problem? If the bleeding is heavy, you should go to the doctor. If there is any altered smell in the discharge, which means it can be an infection. Okay, little foul smell or altered odor, you should go. Or the bleeding starts and doesn't stop within 7 days. It keeps on spotting every day for a longer time. You should visit the doctor. So prolonged bleeding, heavy bleeding, and spotting in between, all these things, you should go to the doctor.
Absolutely, doctor. That was very helpful. Again, repeating, one of the things that hit me the most was you mentioned that the regular birth control pills would be very different from what you would take if you are breastfeeding. I don't think a lot of women know that. So always speak to your gynecologist. That would be the best advice. Get expert help around this. Super helpful, doctor. Another thing that women in our community specifically are very worried about, and honestly, sometimes even as a team, our heart goes out to them. It's women are by default primary caretakers of the baby, of course. But a lot of times they do not get the adequate support that is required, and that leads to aggravated stress, anxiety, and all of this, with the fact that they have just delivered the baby, becomes postpartum stress, anxiety, and which in severe cases is depression, doctor. So two questions. One would be, what advice would you give the women itself on how best to handle this? And the second thing would be, to a wider audience, what advice would you give to the support structure, how to support the woman to make sure that these things are reduced and they don't face so much struggle?
First and foremost, especially nowadays, women before pregnancy, they would have been going out very often. Those days, women didn't go out much. Now it is like, you are jailed, okay, for good causes, but still you won't be able to move out very often as you did without a child. Okay, so mentally prepare yourself for the next 1 year. I will have to restrict my activities if needed. But if you feel like, okay, if there is somebody to take care of the child, you want to move out, go out and have a coffee, tea in a nearby restaurant with your husband, go out. For 2 hours, you want to go for a movie, please move out. Okay, so taking care of your needs important. Second thing, don't feel guilty. Many women, if they don't get a little adequate, if they don't get adequate milk, they feel guilty. If the child cries, something happens to the child, and all our people comment so easily. What did you eat? The child is having diarrhea. You must have eaten something wrong. Okay. So all this sort of things, ignore it. Especially working women. If they leave the child at home with a caretaker, they feel so bad when working in the office. But times are changing. When there is a need to do that, I think we have to accept that. Okay. So don't feel bad, don't feel guilty. When you are physically worn out, okay, sometimes you may even get angry with the child. Why is this child crying and taking my life out? I mean, it's okay to feel that way, but at the same time, just pacify yourself. It's okay, let me steam out. And then, so if you want to cry, you cry and then start doing your work. Okay. It is always better to have a support group. Okay. Your friends or relatives who don't talk nonsense, in the sense, you didn't do this rightly, that is why it happened. That sort of people just would listen to you. And preferably, if the husband is very supportive, he has to understand the emotional outbursts of this woman. Okay. Even if she yells at him unnecessarily, he should understand it is part of the postpartum blues. Or not all postpartum blues needs to be the women have to be medicated or taken to a psychiatrist, nothing of that sort. These are all common things the woman will recover within a few seconds. Okay. It is just that, things are so different. The life which was very free, now it is, dominated by a small boss who needs your attention. So remember, taking care of a child is a pain and pleasure. The pain is also yours. The pleasure is also yours. Okay. So it's part of life. And devote enough time to rest. That is what I always say. Use maximum help that is available. Okay. So your mother is willing to help, use her help. If your mother-in-law is willing to help, use her help. So when you just want to lie down, read a book or watch a movie, leave the child with them after breastfeeding. They will be happy to take care of the child. Okay. So this way you manage your personal needs and then get along. That should be easy to get rid of postpartum blues. If it is really severe, where there may be a problem, like if she tends to harm the baby or herself, that is the time when you should take her to a doctor. All the other times, just listening to her, not even trying to give advice. That will be a most irritating thing. Okay. Just listening to the woman. Let us team out whatever her problems. Then at the end, you just say, okay, I understand, but this is just a passing phase. Okay, you are doing very well. You have done the best for your baby. Okay, take care of yourself. These sort of support from the husband and the family will help the woman to recover fast.
I fully agree, doctor. And you mentioned the importance of the right people, like being around you, somebody just telling you, okay, we are here for you. Unfortunately, for a lot of women, sometimes that doesn't happen and work out. Like, I'll give you an example. One of the women in our community, 55 minutes after her C-section, when she was in ICU, she actually started pinging in our WhatsApp group because she was feeling lonely, and in ICU, nobody was allowed. And everybody in the WhatsApp group, just started chatting with her very, very nicely. They were all there. The mothers were very supportive of each other. I think if we start building that out at scale, a lot of the problems that in nuclear families women now face during and after childbirth will get alleviated with just that community support that they need at such a time.
Even if it is a preterm baby admitted in NICU, once 24 hours are over, I tell the nurses, you take the mother in the wheelchair, let her go touch her baby. Then I tell her, you touch your baby, talk to your baby, okay? Come soon to mother, start breathing well, grow well, feed well. So like that, if you touch the baby, that touch matters a lot. That warmth and that conveying your emotions to the baby. All good, I'll take care of you. I'm ready to take care of you. That sort of a feeling helps the mother to recover fast and the baby to recover fast. This is where the kangaroo mother care, we call it. Kangaroos have a pouch in their abdomen, right? They put their baby, the baby feels safe, the mother feels, baby is there all the time. So actually this kangaroo mother care post-delivery for preterm baby is very good. Where the babies are supported on the chest of the mother or the father. Okay, you can put the baby directly on your chest, inside your t-shirt or whatever. Now we have to, I told you, we have to design dresses for this kangaroo mother care.
Okay. Doctor, yes.
In this kangaroo mother care, actually not only for preterm babies. Say supposing you have to work in front of a system, and the baby keeps on crying. Sometimes the babies cry because they just want to be cuddled. They don't want to be left alone. They don't want your feeding. They don't want your. Soon after feeding, also they will be okay. They just want that cuddling. So that's that time you put the baby on your chest, but tie the baby to your chest, and then you keep working. Even when you work in kitchen, you can do this. Okay. So up to 1 year, when they they don't walk, till 1 year they don't walk. If you give this kangaroo mother care, the babies will be happy, you will also be happy. Absolutely. And this fathers also can do.
Fathers can also do. Very important point. Very well said, doctor. Very important point also. I didn't even realize, because when my little one was small, I started working from a couple of days, in fact, after she was born. And I had to do a lot of this, but I didn't have the right clothing, which you very well pointed out, and we are on it. But you have to hold your baby. That's all they need. Sometimes they just need to be quiet. They just need to be held to be quiet. Very well said, doctor. And because I have you, I would also want to touch upon one very important point, which again briefly we have spoken about before, and that is women's struggle to conceive nowadays. Especially we are also hearing a lot in our community about the spike in infertility because of stress, because of lifestyle, because of n number of reasons, doctor. So what are some things that these women should think about making changes, visiting the right doctor? What do they need to do to be able to conceive naturally?
First and foremost, they have to keep themselves fit. Remember, nature chooses the fittest. Okay, so optimal weight, optimal activity. It is a must. The second thing is, even if the woman and the man are 100% perfect, the husband and wife are 100% perfect, the chances of conceiving in one particular menstrual cycle is only around 20%. At the end of 1 year, as a cumulative result, 70% of the women conceive. Another 20% of the women take another 1 year. Sorry, there is a call. I won't take the call. Is it disturbing?
No, doctor, not at all.
Okay,
I can hear you.
Okay. So if the woman is, oh no, I was just
fit
getting
and
back.
it takes them.
Yeah. So keeping yourself fit is important. The chances of conceiving in one particular month is only 20%.
Right.
So give nature its due time. You attempt pregnancy 2 months, 3 months, you don't conceive, then you go to a doctor, then you over-medicate yourself, and then you end up in a mess. Okay. So always, it is fine to go for a pre-conceptional counseling. Before you become pregnant, go check whether everything is all right with you. Whether your weight, your hemoglobin, sugar, thyroid, your uterus, ovaries are normal. That is fine. The husband also can have a basic checkup. Once it is normal, and if they have no difficulties in having a normal relationship, they should wait at least for 1 year. Okay. Then if they don't conceive, they should proceed with medications, investigations, and treatment. So basic health checkup, fine you do, but don't over-medicate yourself. Most of the women with polycystic ovaries, their problem is a diet which contains more carbohydrate and there is no physical activity. Okay. When you sit for a long time in front of a computer, work for 8 hours without moving your body, what happens? When you sit constantly, your uterus is in the pelvis, right? That portion becomes stagnant. The blood flow in that region becomes so stagnant. So you move every 1 hour. If you have a job in front of the system, every 1 hour you get up. Move for about 3 to 5 minutes. 3 to 5 minutes is nothing. Okay, you can do on the spot walking. If there is a stairs, climb up, just bend forward, twist, stretch your legs, So this should be done. This has to be done consciously. And many women have the wrong concept of thinking that when they try for pregnancy, they should not work out, they should not do any strenuous activity, they should not climb stairs. This is a very, very wrong concept. Okay, you see people who are physically active, manual laborers, people who live in hill stations. How do they conceive? Okay, because they are fit, actually, their chances of conception are more than people who idle. So, keeping yourself fit by diet and exercise, and remember, it's absolutely good to wait for 1 year after marriage before going for any serious investigations or medications. This is very, very important. And any woman who wants to become pregnant should take folic acid. This folic acid tablet is not to make the woman pregnant. There are certain defects called neural tube defects in the baby, which can be prevented to a very large extent by this folic acid. And we don't know which month the woman will conceive. And this neurological defects, the neurological system of the baby starts developing before even you miss your periods. Okay, so that is why the folic acid has to be taken well before you attempt pregnancy. Not like once it's positive, if you take folic acid, may prevent only anemia.
Hmm.
It may not prevent the neural tube defect. So it doesn't do any harm. It's only a folic acid, one of the vitamins in the B complex unit. Even if you take in excess, it gets excreted in the urine the same day.
Mhm.
So it is always good to take folic acid. It is one of the very, very useful preventive medicine actually.
Right. Right. Very important things again, doctor, like you highlighted. One, obviously, around the folic acid. The other thing that hit me again was because we have a sedentary lifestyle, we have a sedentary job. So just up and moving, you know, you're like, I have this meeting, this meeting, this meeting, and then for 5 hours straight, you haven't moved from your chair. I think that's a very, very important point for women to keep in mind. Maybe not just if you are planning to conceive, but also for the others. My last question to you, doctor, is you are a mother yourself,
Yeah.
and you are such an accomplished woman with a massive career that you have built over the years, and obviously the times have changed drastically in the last few years as well. How have you faced it all, doctor? How was your journey, your motherhood experience, and what advice do you have to the upcoming generation of mothers?
Apart from all that I told you, keeping yourself physically fit, mentally fit. It is okay to feel sad, it is okay to feel tired and all those things. I had a big favor bank. I had been in good terms with my mother-in-law, co-sisters and sisters. Everybody contributed in bringing up my child, and my husband was very supportive. So there were no demands from anybody. So I could do that. That is very, very important. That is why you have to keep a good relationship with all your family members.
Very well
That
said.
that I think was, and I had, there are times balancing your career and family life is something you have to plan. There are times, when I could not study much. It was only practice and the family, taking care of the kids. Saturdays, evenings, and Sundays, I used to take off. Okay, that was fine. We make it a habit. We will eat out, go for a movie, go to some place, and spending that sort of a time. And whenever there was a parent teachers meeting in the school, without fail, I will go. I'll take off and then I'll go on that day. Then at a later stage, when I started having my own hospital, I had colleagues. So we started sharing the practice, career work also. The obstetrics work also. We used to take shifts. Okay. So this shift, whatever comes, I will take care. You be at peace. So initially, it was a family who was doing, sharing of taking care of my babies. Later, my colleagues in my career, as I grew older, when physically I could not work longer hours, there had been times when we had worked 16 hours, 18 hours together. But now, we are able to share the work and do it. So that is sharing teamwork anywhere, whether at home or in your office. This teamwork helps to carry on better in your life.
Absolutely, doctor. Wow, that was so well said. Also, very, very inspirational. Gives a lot of food for thought to the young mothers. You personally, I know you, doctor, you have brought about such a difference to so many women's lives over the years. You have had a huge impact in, well, every single day. It's very few women, very few people in the world who can have that sort of satisfaction in terms of what they're doing. Doctor, you brought a big difference. A lot of women are very thankful to you. I read somewhere one lady had written that, I have a 9-year-old and an 11-year-old, and Dr. Bala delivered both, but if I still go to her, she will remember my children and she will remember me. And that I think that one single lady's feedback means a lot. She brought out what you stand for. It was amazing speaking with you, Dr. Bala, and I would love to have lots more conversations with you around this.
Sure, sure, Hina. Very, very happy to have done this podcast with you. Thank you.
Awesome.
Thank you. It's an opportunity to share my ideas also. No, it's always a pleasure.
Thank you so much, Dr. Bala. All
Thank
right.
you.